To slightly shift the abdomen towards the left. So how do we do that? Use a blanket, the right side of the hip, the right bum. You slightly lift and you place your support. So it is tilted slightly to the left. Why? This will prevent the baby from resting directly on her blood vessels. And if the baby should rest directly on her blood vessel, you will be worsening her condition. Hello and welcome to today's episode on life-saving aid. Today we are going to be looking at cardiopulmonary resuscitation in a pregnant woman that is unresponsive. So how do you know an unresponsive pregnant woman? First, you look at their breathing. They might be having abnormal breathing or they might not be breathing at all. What we commonly describe as this person is looking lifeless. Next, you check for the pulse. And for adults, be it pregnant woman or any other adult, the best place to check for the pulse is at the neck, where the jaw connects with the neck. That's where, with your two fingers, you press inward to assess for pulse. When you press deep, you don't feel any pulse, you start your CPR immediately. In our previous video, we talked about choking in a pregnant woman. And one common cause of an unresponsive patient is choking. So a pregnant woman can be choking, and before you know it, while you are trying to relieve the choking using the maneuvers we taught in the previous video, the woman can become unresponsive. In that situation, you don't continue to try to relieve the choking. No, what you do is you start CPR immediately. And CPR in pregnant women is slightly different from CPR in other adults. How do we carry out CPR in an unresponsive pregnant woman? Okay, lay her on her back on a flat, firm surface like this. Okay, gently, remember she's pregnant, so gently lay her on her back on a flat, firm surface. Okay. Try again to assess that she's really unresponsive. Hello, can you hear me? Can you open your eyes? Can you hear me? What's your name? No response. Before you start your 30 chest compression and 2 rescue breaths, one very important thing you do, because of the womb, because of the baby that is resting directly on her blood vessels, you support the right side of her hip using a cloth, a blanket, or a pillow. Okay, anything you can get. The reason why you are doing that is that you want to slightly shift the abdomen towards the left. Remember, you want to slightly shift the abdomen towards the left. Why? This will prevent the baby from resting directly on her blood vessels. And if the baby should rest directly on her blood vessel, you will be worsening her condition. So how do we do that? Use a blanket, the right side of the hip, the right bum. You slightly lift and you place your support. So it is tilted slightly to the left. And then you immediately activate help. Call her husband. They should call her relative. They should get us a car. Call emergency medical services. And then you start 30 chest compression, 2 rescue breaths. Now, because of the peculiar nature of this victim, she's a woman who is also pregnant. You don't go trying to look for where the nipple is so that, oh, across the nipple line, you know. What you do is, in between the two breasts, place your fist and start applying your chest compression. In between the two breasts, in between, okay? You apply your 30 chest compression like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay? And you give 2 rescue breaths. You tilt the head backward. With your 2 fingers, you lift the chin up. You give your rescue breath while you're looking at the chest wall. How you know it's effective is that when you give your rescue breath, the chest wall will rise and fall. Not significantly, but you'll see it move up and down. You give 2 rescue breaths like this. 1, 2. You continue. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2. You continue your 30 chest compression, 2 rescue breaths, 30 chest compression, 2 rescue breaths. Your aim is to give 100 to 120 chest compression in 60 seconds, in 1 minute. So you have to be deep and fast. 30 chest compression, 2 rescue breaths until emergency medical services arrive or until you get to the hospital. With that, you'll be able to increase the chances of survival of this woman. I hope this information helps someone out there. Share this video to save a life. Stay safe out there.